with Celena, the podcast where we discover inspiration, motivation, and information to help you live your best life. I'm your host, Celena, aka Sunshine, and each week we'll dive into conversations with guests who share their testimonies, insights, and advice. We'll explore topics that uplift, encourage, and empower you to be the best version of yourself you can be. So tune in and let's have some fun while we explore all that life has to offer. Keep it smiling, sunshine, and let's go. Hey, sunshine. Hey, sunshine. Woo! Welcome to another episode of Conversation with Celena. I am so excited. Listen, let me tell y'all before we even get started. I do apologize for the delay. This has never happened before. When it was time to go live, we received a message from StreamYard that it was high traffic. And so wait 60 to 90 seconds. Well, that was 30 minutes ago. So we just was patient. We continued to talk and wait and try and talk and wait and try. And I was like, I don't know when this is going to work, but we might go live at any time. So I'm so excited that it's working. Thank you all for your patience. So what we're going to have to do now is try to share. We're going to try to share. So be patient just a few more minutes. And as we try to let our audience know that we're here now. So while you're doing that, let's see here. I'm going to grab the link real quick, fast, and in a hurry. I'm trying because it finally worked. And y'all do the same. So don't leave me over here by myself. Y'all share the video with all your friends and all your family, your coworkers, your enemies. We're supposed to pray for them anyway. So go on, share it. Okay. I just grabbed a couple people. So, all right. So y'all share the video. Thank you very much. Thank you for your patience. I am Sunshine, and this is Conversation with Celena. If this is your first time, welcome. If you're returning, you know I love you so much. Thank you for your continued support. Y'all, please be sure to share the video. The only thing that I'm asking of you all, go find the graduate flyer and share it. We are looking for graduates to celebrate next month. If they don't want to come live, have them send their pictures and their information so that we can still recognize them. So they don't have to come live, but we would like to get their information so that I can put it up on the screen and we can celebrate them. And I think that's it. That's all. So we can move right on into tonight's episode. You all know that mental health is very important to me. And I think this thing got me sweating. Woo! Mental health is important to me. And tonight, OMG, we have Dr. Watson. I cannot wait to bring her up on the stage. She is, first of all, beautiful, but she's also super smart. And she is a dedicated healthcare professional with a passion for helping others. She has extensive experience as a nurse and nurse practitioner and is committed to providing quality care to the uninsured and underinsured. Dr. Watson identified a need for mental health services, a big need, still a big need, identified a need for mental health services in her community and obtained her psychiatric mental health certification. She is a lifelong learner with a focus on faith-based healing and education. Dr. Watson is also the founder of Blessed Royal Honey B73, a mental health awareness movement that uses testimony and education to reduce stigma. So, y'all, welcome to the stage, Dr. Melissa Watson.
Hey,
Yes, girl, you
hello,
finally made it.
sunshine.
We finally made it. Look, it'd be a testament. Don't
Yes,
give up. You got to wait it out sometimes,
that's
and
right.
it works out. Wait it out,
That's
and it
right.
works out. So now,
That's right.
who them people had me sweating over here?
Oh, we wasn't about to give up on this.
We wasn't giving up on it, but it has never happened. I've been doing this we're in our 4th year. Like, I was like, I never seen this message before. Child. Okay,
Woo.
all right, girl. We ready. We ready. So I did read your bio, and
Mhm.
thank you for being here with me tonight. Thank you for your patience. I cannot wait to jump in this conversation with you. Oh, look at my kid. Hey, Sunshine. He done showed up for his mama. Thank you, child. Thank you. Be sure to share the video for me also if you're just joining. So, Miss Melissa, Dr. Melissa, Miss
Yes.
Mental Health Awareness Melissa, tell us, how
Yes.
did you decide to get into mental health?
Well,
You
first
can
of all,
introduce yourself and say something maybe that I didn't. I don't want to omit anything that you want to share, but I'm just like, girl, we needed you. I know I needed you like 30 years ago. We was the same age at that time, but honey, I needed some help and still do.
well, let me tell you, mental health was the furthest thing from my mind. I mean, when I went into the healthcare profession, I didn't want to be bothered with anybody that dealt with with mental illness. You know, um, just like many people out here and how I felt about
Mm-hmm.
mental illness has been stigmatized for so long. And the effort of making mental health awareness known is that we reduce the stigma of mental illness and mental health. There's so many people that they suffer in silence because they're afraid of what others may think of them, that they're cuckoo or crazy. Mental illness and mental health doesn't mean that you're crazy or you're cuckoo, you know and mental he- mental health, I became very passionate throughout my years in the healthcare industry as a nurse, because I found myself, I connect really well with everybody, really. So, like I said, I didn't think mental health would be anything that I would be, channeled into, but I have a long family history of mental illness, and so it's very dear to my heart, you know. So I decided that back in during the COVID pandemic that I was going to go back to school to obtain my certification in psychiatric mental as a mental health nurse practitioner. But I had before then, I had so many people coming through my practice needing help, and they were so broken, and so they would come to me and just look for prayer and answers. So I decided to go back during COVID because people, they were suffering. They were really suffering.
Well, I'm glad that you did, because we're still suffering, and it's very hard to find the health care that we need. I reached out probably, it may have been a month ago. I was looking for EMDR. They
Mm-hmm.
haven't gotten back with me yet.
Yeah,
And it's like
that's right.
it's so difficult. And people that are in practice, they are booked. It's because of episodes like this bringing awareness to the mental health and removing the stigma, that now everybody is trying to get appointments. That I went to go to a practice the other day. The girl has shut down. The last time I reached out, she was so booked. She didn't even, it was overwhelming. It was
Yeah,
and
It
she did
is.
not have enough hours in the day to get everybody.
That's right. Yes, and there's a big shortage of mental health providers. And it's not for everybody. You know, people are chosen to do this
Mm,
because you can't connect. And there are a lot of people, when your mental health is fractured, you want to talk to somebody that is sensitive or somebody that can relate, and everybody cannot relate if they haven't walked in your shoes or they don't have the knowledge,
mhm.
or even the empathy, to know that mental illness is real. And I like to look at mental illness or mental health. Okay, we're going to break this down a little bit. I'm a family nurse practitioner, okay? So I see everybody. But if something was wrong with your heart, wouldn't you go to the doctor to get your heart take looked at? Wouldn't you go for treatment for your heart? The heart
Mhm.
is a part of your body. It's an organ. So is your brain. It's a part of your body. It's an organ. And the brain, you can't do anything without your brain. You can't breathe without your brain. You can't eat without your brain. You can't sleep without your brain. So,
And
in
that's the
order
last
for
thing
you to
we try to take care of.
exactly,
Mhm.
exactly. So you have to take care of your mental for your physical to be made whole, you know? So we definitely need to be educated, you know, everybody needs to be educated how important mental health is. Do you know that at the age of 14, 50% of lifelong mental health illnesses, that's when it starts at the age of 14. So, this is nothing, it's nothing to play with. As much attention as we're putting into other, diabetes and hypertension, we need to also be putting into mental health. You know, there's about 50, I think it's about 500,000 or 50,000. I can't think really offhand. Um, Cases of suicide, 500,000, I believe it is, cases of suicide a year. And more men are successful at suicide than women, even though women attempt, but more men are at risk for dying from suicide attempt. So we definitely have to promote, more wellness and advocate, for more resources for mental health. Um, with COVID, when COVID arose, the suicide rates increased. You had people, they were isolated. They had nowhere to go, nothing to do, limited access to health that was available, financial burdens, all of this trauma that people has, endured in life. They had time to sit back and realize, that all of these emotions, what else, what can I do? So the depression and the anxiety just increased and it became worse, over the COVID pandemic. And that's when we started seeing, rises in a lot of substance abuse and depression, anxiety, um, and the age group where you're going to see a lot of the mental illness and depression is around the age of 25 and 34, you
Mm.
know so we have to, it's promoting that awareness is extremely important. And talking to our leaders in Congress, you know to 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 develop programs to prevent, and that's the important thing, prevention. We want to prevent these things from happening with early education, and awareness, and making resources available, and offering support for each other,
Mm-hmm.
because there's, I could speak for myself, having a long family history of mental illness. I saw it firsthand, you know, and walking up the street looking at my uncle boxing in the air, other people thought it was funny, or they were scared, they were scared of him. But if he would have had, someone to take the time to treat him appropriately, maybe he would have been more productive in life,
Mm-hmm.
you know?
And
So,
untreated, it really does get worse because
yes,
you start to spiral
yes,
down without
yes.
getting the proper help. Because a lot of times before Google even came to the scene, we were trying to self-diagnose, avoid, we would do the avoidance, like, that's not really happening to me.
Mhm,
I don't really know what it is. And
mhm,
people just went on with life, like did not go to the doctor, did not talk about it. And
mhm.
so it went untreated, and it negatively affects your relationships,
Yes,
your
yes,
relationship with yourself, your
yes.
relationship with your spouse, your children, your family,
Mhm.
everybody, because you don't have really good, what do I want to say, like, is it
You don't
emotional
have good
intelligence?
coping skills.
You
Yeah,
don't have
I
emotional
mean,
intelligence and coping skills and things
mhm,
like that. And so we let our emotions just run our life.
right, right. And I like, like to say, if you're everybody has we all go through things in life, right? So when you have mental wellness, you have those skills and that I would like to say that resilient to bounce back when you're faced with different obstacles, such as trauma or grief, those things that cause us to become depressed or anxious, you know. So that's where that mental wellness comes in at, having that ability to be able to recognize, what's healthy and what's not healthy, you know. So with mental health or mental illness, there's different types of mental health, mental illness, from depression to anxiety to what they call PTSD, post
Mm-hmm.
traumatic stress disorders, bipolar disorders, schizophrenia, paranoia,
All
which
kinds of stuff.
all of things, those things could be, some things are caused by environmental factors, some
Mm-hmm.
things are genetic,
Yep.
some things could be brought on by hormones, so we have to educate ourselves, you know, to recognize and understand how important it is when you need help, you know?
Mm-hmm.
So I was reading somewhere where it said 1 in 5 adults each year, I think it may have 1 in 5 adults receive help, that are depressed, that receives help for mental health, you know? And I think too, where I find just in my practice, people, they don't want to be labeled,
That's right.
and they're concerned that being labeled with maybe depression will prevent them from having a certain job,
Yeah.
or having anxiety will prevent them from having, a certain job or being accepted,
Mm-hmm.
you know. So we have to, we it's just education. We got to educate each other in on terms of mental health as being, a part of someone's body, you know. It's a part of your body, so you need to take care of it
You
and
need
not
to
be
take it
afraid.
and
Yeah,
make it a priority.
yes, yes.
Mm-hmm.
Because I can I can say this, just in my practice, I hear this all the time. People, everybody has different coping mechanisms that they use.
Mm-hmm.
And then you've used so many, you've used those coping mechanisms so much to a point where you break. And the brain is like a file cabinet. You know, you if you're going through, I'm gonna use this for example, trauma or
Help us tonight.
rape. I'm gonna use rape or molestation. Okay, that was something that people didn't talk about, right? It's just something that we don't talk about, we don't discuss. For one, you're a lot of people that have been through those things, they're embarrassed, or they feel like they've done something wrong. So they put it in, it's filed in the back of your brain, just like a file cabinet. You put it in the back of your brain and you close the drawer to the file cabinet, right? So you're
Mm-hmm.
going through your years and you're coping and you're going through life, and then something else hits you, boom, something traumatic hits you. Well, guess what happens?
The
The file
file cabinet drawer
opens
falls
right back up. That's right.
up.
And
Mm-hmm.
it reminds you of the trauma. So guess what? It's worse than it was. So that's why it's important, for us to utilize the resources we have, seek however we need to do, seek therapies, grief counseling, whatever we need to do
Whatever. Mm-hmm.
to, get the help that we need. Because I can tell you and I can say it, you can get through it if you have the right resources. You can be treated. It's treatable. It's treatable just like hypertension is. Mental illness is treatable. And we want to have it treated before it turns into something as devastating as suicide,
Suicide. Mm-hmm.
you know. So I know for myself, I've been through, what you call sometimes situational depression. And I think a lot of us also go through situational depression or seasonal depression, in which, certain times of the year people get more depressed than others.
Mm-hmm.
um, or if you have lost a loved one, you go through what they call acute stress reaction, or depression, and it may not last long. Where you have some people that they have they're always depressed, and it's an imbalance in the chemicals in the brain. So I can't stress enough the importance of finding a healthcare provider that is attentive, to recognizing when the individual needs help, or even a family member for that matter, recognizing when that person needs needs help and attention. Because let me tell you, there is a thin line between sanity and insanity. And I never could understand how one could take their own life, but until you've either walked in that person's shoes, or you really understand the severity of mental illness, it's really really real. And there is no face of who doesn't have mental illness and who does and who does not, because we typically put on a front, and what you see on the outside may not be what's in the inside.
That's the truth. That is the truth. That's one of our
Because I
coping
know,
skills.
yes, and I was talking to a gentleman today in clinic, and he said, Dr. Watson, he said, I just don't know how much more I can take. He said, I know that I'm working and working and working and working because I'm avoiding, dealing with what's going on, in the inside of me. And I
Mm-hmm.
said, I'm gonna just be real with you. I said, I've been in your shoes. I said, I've worked tirelessly, and I kept going and kept going because that's how I coped
Mm-hmm.
with things, traumas in that I've had in the past, and depression and anxiety and grief, all of those things. So I said, eventually. Your body's going to talk to you.
Mm-hmm.
But I pray that you get help. And I'm glad you did come today, so that we can help you before it's too late. And he
Mm-hmm.
said, because men really don't,
They don't
like I
talk.
said, you have to connect with the patient or the person, because a lot of times if you could say one thing or make one facial expression and that's it. You're done. The
Shut
person,
down. It's
they're never
over.
going to come back and see you, or they're never going to seek help.
Mm-hmm.
And he said, I never thought in life that I would feel like I wanted to take my life. He said, so that's why I'm here today. And I'm sitting there crying with him, because it's relatable.
Mm-hmm.
It's very relatable because
It's
it's relatable because I've been there where I wanted to die.
mm,
And if it wasn't for prayer, and having that strong faith, because everybody, everybody's not strong, you know, everybody has a breaking point. But I had to make a decision that I wanted to live and I wanted to seek help for myself.
mm-hmm.
So that's important. You have to, you can't keep running away from it. And you need to talk to people that have the same emotions that you have so that you can understand how real it is. In
It's very
therapy,
real.
I don't care if you're in therapy the rest of your life. If that keeps your mental sanity intact, your emotions,
Do it. Mm-hmm.
do it. You
Mm-hmm.
know, do it. You have
Because
to
we're dealing
do,
with one day at a time. We're
yes,
really dealing with one day at a time. And so if today, this episode or the patient that you had today, if you helped him get through today, that helps him get through the week. And
yeah,
so it's a journey. You don't just automatically wake up and you've arrived. Oh, I'm healed. I don't have to be worried. I mean, and if you have, because I don't like to say it doesn't happen, but if it happened for you, oh my God, you are truly blessed. But
mm-hmm,
for the rest of us that's on a healing journey,
mm-hmm,
we have to be patient and give ourselves grace because a
that's
lot of
right,
times, like you were saying, you feel guilty, you're embarrassed, you're ashamed, and none of it you should be ashamed of. None of it you should be embarrassed of, but that's what happens when it's abuse or rape or
that's
trauma.
right, that's
You
right,
know, you carry the burden.
that's right,
It's not your burden to carry.
that's right. And
So it's
and you got to,
what
somebody's got to
you
open that door for you to
think.
feel comfortable to
Mm-hmm.
be able to speak it, because it's nothing that you did wrong. That person that did it to you wasn't wrapped tight either in the brain. They could have had trauma that they never healed from, because let's think about it, hurt people hurt other people.
Amen to that.
So that person, sometimes you got to have a little, and not to say that it's a pass for the person, that the abuser, but I'm pretty sure that abuser has had some form of trauma or abuse for them to have abused someone else, you know. And recently I, experienced, a form of where, like I was telling you, I wanted to give up. I was just done. Like, you know what? I can't do this anymore. I can't do it anymore. I've poured into everybody. I can't give anymore. Because if your cup is empty, you show you can't help anybody.
Dried up. You
You
just all dried
dried up. And every time I would get a little bit in my cup, I would empty it out because I just felt like I had to save everybody.
up.
When I forgot who I was, that I was human too, and that I went through things myself. But as I was going through the journey, I that's when I started. I always use journaling for, a means of coping, and for my just a mental outlet. And that's when, God gave me the revelation that I needed to do the inspiration, well, the motivational slash self-reflecting journal. And that's when I took each one of these emotions that everybody feels, a lot of them that I felt, and put it into the book. This one, Born to be Royal, Blessed to be Crowned. And a lot of people feel like they can't speak out loud, which is why there's this big stigma, because people feel embarrassed, or they don't want people to know their business, or they don't want people to know that they're dealing with mental health, or whatever that may be.
And child, we
And
all had the same business. At the
yeah,
end of the day,
yeah,
most of us have the same business. It
exactly.
happened to you. It happened to one of your loved ones, your siblings, your somebody.
Yes.
So it's nobody's personal business. Like,
Mm-hmm.
but that is part of it. And because I was that person too. So you keep it to yourself, and you do come to a breaking point,
Mm-hmm.
and sometimes it could really cost you your life because you're walking around with so much unforgiveness and
Oh
bitterness
yeah.
and
And
anger. And
it keeps you from reaching your full potential.
it keeps you from living your life.
Yeah.
I
Because
mean,
you're stuck. You're stagnated.
you are. And before the full potential, you ain't even come out the shell. It's like you peeking out and you seeing everybody else living and loving their life, and you just go back into your little shell because that guilt and shame, it's like you're clothed in guilt and shame and depression and anxiety. You name it, if it's negative, you got it over you. And then that self-talk, like you're not
Yes.
worthy and you're not good enough and you're damaged goods, and that's all you're good for. Just all that kind of stuff. You got to
And
shut that
sometimes
down.
we're our worst enemies.
Mm-hmm.
You gotta empower yourself.
But you got to know
You gotta
how.
want to help yourself. You gotta want to get out of that rut. Every day is not gonna be peaches and cream. It's not gonna be easy, and you're gonna have setbacks.
You definitely will.
You know, it's called reality. It's called life. We're gonna have setbacks.
Right. It's called reality.
But
Mm-hmm.
it's almost like if you have a wound, right, in the physical, and the wound is open, and you keep touching it, right? It's never gonna heal, right?
Mm-hmm.
Why are you touching something if you know you want it to heal, and if you keep on touching it, it's not gonna heal? Think about the mental side of it. You know, once it's opened up, you closed it, and you heal from it. Don't open it back up, because it's just gonna lead to something bigger and bigger. And it's almost like, I was thinking about something the other day, and you know how people are in relationships, right?
Mm-hmm.
And the person, I'm gonna just use a man and a female in a male relationship, and someone's cheating or whatever, however you want to do it, or that this person's abusive, and you've been delivered from it, right? But you go back to it, and then you go back to it again. Every time you're delivered from it, you keep going back to it. When you've been delivered from something, or when it's behind you, sometimes you got to leave it behind you, because that's the only way you can move forward. How can you move forward if you keep looking back? You
Mm-hmm.
got to move forward.
Girl, say it again for the people in the back.
How can you move forward
When you
when you keep looking back?
keep looking back, you cannot drive a car looking in the rear view mirror.
No.
You got to
No.
look at the big picture, that big wide windshield that's in front of you, not that little small thing that's behind you.
Yes.
Because we make our problems so big, and they do seem so big to us when it's happening. And I
Yes.
saw this thing the other day that made God the bigger thing and the problem the smaller, because it's your mind that
Mhm.
makes these things
Mhm.
just so huge.
Yes.
But it's like, if you serve a God that can take care of it, no matter how big it is, it's really like this.
Yeah.
It's really like this.
Yeah.
So,
And not only that, some things that I also learned, and what I try to tell people is the only person that you have control over is me, yourself.
Mm-hmm.
So if you can't control it, just leave it alone. I could tell myself anything. I can control me, but I can never control anybody else. And you got to take that, that mindset.
Mm-hmm.
You have to take that mindset, especially when you're trying to heal from something. You got it's kind of more or less allowing yourself, you know, to heal and to give yourself, okay, you're doing this. You're doing this. You can do this, girl. Stand up. Man, you could do this. Give yourself permission to heal. You got to give yourself permission to heal. You got to give yourself permission to overcome what you've been through.
Mm-hmm. And sometimes people don't know what that looks like. And so that's why we're here to say seek professional help.
Yes.
Don't ignore it. If you got to seek professional help the rest of your life, just make that a part of your routine. Just
Yes.
like your regular checkups,
Yes.
they may be once a year, but this might be once a week. If
Yes.
you need to take medication, take
Yes.
medication. Find someone that you can trust, because the doctor is only going to give you 45 minutes. Because I remember, girl, one time, this is years ago, I was just opening up about some of my abuse.
Mm-hmm.
And it take you a while in the therapy session, to kind of get warmed up and stuff. Girl, I'm like, oh, and she's like, okay, well, I'll see you next week. Like right in the middle of what I felt like was a breakthrough. I was like, and that'll shut you down too. Like
Yes.
saying one
Yes.
little thing, one look, one response, and that shutdown when I was just opening up about it, I went right on back into that
Yeah.
shell,
Yeah.
looking out at everybody else living life once again.
Yeah.
So
Yeah.
that's
And I
why we're
think
here.
that's important to have support, a support group or support systems, like-minded people, or people that have been through those same traumas that can relate, where you can just pour it all out,
Mm-hmm.
you know, um, because you can't heal from trauma overnight. It doesn't, your brain doesn't work like that. Once it's that part of the brain has been exposed to that fear and that trauma, it's almost like it's scarred, you know, but you can be healed. You can be healed. And you know how when you're starting to heal from things and you've accepted it, because you're going to go through different stages. You go through denial. Nah. You go through it, acceptance, but when you know that you're on the road to healing, you can freely talk about it, and you'll be used as an instrument to help someone else as you're going through it. So you have to go. Sometimes we go through the stages multiple times. You go through guilt, but it is a process.
It is.
You
It's
might go through the same cycle 3 or 4 times. But
and so your circle has to be a circle that's understanding. If they're not understanding, and it's not a circle where you talking about your problems, they're talking about their problems, and now you went there depressed, you leave severely depressed. Like, that's not the type of circle that we're talking about.
no,
It's getting with somebody who has been through it, but they're walking in their healing,
that's
and
right.
their purpose in life is to
That's
reach
right.
back and grab the people that are not healed but want to be healed, because you
Hmm.
can't get help. Like they say, a closed mouth don't get
Don't get
fed.
that.
If
Yeah.
you don't open your mouth, no one knows that you need that type of help. I didn't know
Yeah.
y'all couldn't see my hands. Like I just been talking with my hands. I feel so short down here. But yeah, so Even when I was making the motion with the little thing, I'm down here, girl. Lord, that's funny. But so yes, you have to open up your mouth and request help. And
Yeah.
that is so hard for some people
Yeah.
to ask for help. I don't
Yeah.
know if it's pride, I don't know if it's
Hmm.
fear, I don't know if it's just a combination of all of that, but it is very difficult for people who have been um, in any type of traumatic
Yeah.
situation
Yes.
or
And it doesn't matter what
just,
color, what race, what creed you are, you
mm-hmm,
know. But I know a lot of culture has a lot to do with it because back in the days, you see it more now where more people are getting help. I'm gonna use this for example. Children with ADHD, you got your tail toe up if you cut up in school and you didn't pay attention. You
mm-hmm.
just got, and even in the Black community, people just didn't talk about that kind of stuff. You suck it up. you know you suck it up, and a lot of people looked at mental illness as um witchcraft, or somebody had, Satan was in them, or something like that, forgetting that the brain is a part of the body. It's an organ. But it was called ignorance. And when you know better, you do better. So I can't stress enough, you got to take care of your mental. you
Mm-hmm.
can you can you can tell this brain to do anything you want it to do. Anything. Anything. Trust me.
So
Because
who
if you
do you
think you're
encourage
negative,
your patients?
huh?
How do you encourage your patients to get this started? What do you tell them to like integrate into their daily routines? I know the journal because we're going to talk about the journal a little bit more,
Mm-hmm.
and what inspired you actually to create the Blessed Royal Honey B73, and how you came up with that name too. Like we're gonna move on into that, but like so that anyone that's listening can start right now, right where they are with what they have. Maybe they don't have insurance, maybe they still are a little um, shy or ashamed. What can they do right now that would be beneficial to start their healing journey?
Yeah. Well, I'm gonna say this first. It's okay not to be okay. First of all, you have to accept that you do have an issue that's going on. And I say you got to start, some good mental health tips would be prayer and meditation. Even if you don't pray, at least take some time and meditate. um Definitely eat right. And if you can't afford to go to a doctor, there are things that you can take over the counter, to treat your some of your symptoms. But you just have to be careful about different supplements that you take. But anything that's brain healthy, if you can't afford, to see anybody. But I would highly encourage you to at least take 5 or 10 minutes out your day and just write it down if you have no one to talk to. I mean, writing releases so much, that you don't even realize you have in you. Once you start writing and you go back and you look at everything that you've written, you'll be surprised how much you have in your brain, and how much have that has impacted you over the years. So I would encourage you to do that. Definitely get proper rest so that your mind can not race but relax. Also, affirm yourself. Stay positive, and encourage yourself throughout the day. When you have those moments where you feel like you just can't, encourage yourself. Yes, I can. I know I can. Words like that. And I want to go a little bit back to like some of the supplements that that are good that you can do, like fish oil and folate and vitamin D. Different vitamins will help with your mental health as well. And also exercise. I don't know if I said exercise. Exercise releases a lot of chemicals in your brain, to kind of help with coping and releasing a lot of stress that's on your mind and body. So, and just knowing when to seek professional help. Don't get to the point where you have so much inside of you that you are at the point where you want to take your life, or you're so far gone that you have to go into a mental institution um to be placed on the right medication, or for someone to take, just like almost like a small mini prison is what a lot of my patients call it. So they try to get to me first before before they are admitted into the hospital. And my goal is to try to keep people out of the hospital if I can at all costs. And that's even with just trying to de-escalate them, or offering any type of prayer, counseling. A lot of times they say if they could just get to me, they'll be fine. Just find someone that is relatable. Because if you can't find someone that's relatable, then you're going to feel stuck. And everybody needs somebody to talk to, but you have to talk to the right person, because you don't want anybody giving you the wrong advice either.
Girl, still back here typing that last one. Prayer, meditation, and counseling. All
Yeah.
right.
Yes. And love yourself first. You definitely have to love yourself. You have to love yourself, and you have to take care of yourself. Definitely.
Because it's like you attract, it's like a magnet. Whatever is like on the
Yes.
inside of you, that's what you attract more of. So if the thoughts are negative, if the self-talk is negative, if you feel depressed and sad and all these types of things, you're going to get more of that. Like you're going to attract that. And you're like, I feel
Yes.
worse today. It's because you
Yes.
just attracted all of that negativity. And if
That's
you
true.
started talking and somebody else jumped on the bandwagon and somebody else, and you're hearing
Nothing
all
but
of this,
negative.
speaking all of this, yes. And so once you change, like it just draws in positive people. People want to be around you when you, how they say it's your frequency or whatever is high, but I
Yeah.
don't even know about all that. I'm just knowing that
Yeah.
you spent time with God, you've meditated, you've prayed, you've worshiped, you've journaled, you've done all of these things, you've affirmed yourself. You can go out in the day and you truly have the joy of the Lord. I was talking about that before,
Hmm.
earlier, I think in the week, maybe last week. Happy versus joy. Happiness
Yes.
versus joy.
Yes.
Happiness is about all this
Temporary.
external stuff, but joy
Forever.
forever.
Forever. It's
And
forever.
that just makes me excited because I notice now, because I'm walking in my healing, that the people who are supposed to be in my life, they're coming in my life, and you're not running behind anybody. Like that's a thing of the past, like running behind people and trying to have relationships with people that don't want to have relationships with you. It's like God is
But
just
that's a compensatory thing that we do when we're traumatized.
like codependency.
It is. You overcompensate when you have been through trauma, and you feel like everything is okay,
And see,
and you're
people
defensive.
use that. People use that overcompensating,
Yeah.
and they pick up on that. That's another thing that's on the inside of you. It's
Mhm.
like you don't have the confidence that you need, because people that don't overcompensate,
Mhm.
it's like they're a magnet. like we're talking about, because they're confident.
Mhm.
The people that's overcompensating, that's traumatized, that is not healed, they're doing the extra, and the extra is not being appreciated. It's actually unattractive. The
Mhm.
most attractive thing that you can wear is confidence.
That's right. That's right. Absolutely.
Yep. And not
Absolutely.
self-confidence.
Yeah.
I used to think self-confidence, but God confidence. Like,
Mhm.
you have the confidence that God has you no matter what.
That's right. That's
And
like having that faith. You gotta have the faith.
gotta have
Even
the
though it don't look good, don't even think you're gonna ever be healed. If you have faith to believe you can be, it can be done.
mm-hmm.
Doesn't
Because
mean you're not gonna have obstacles, but it can still happen.
it could be done. Yeah, it could be done.
And I was saying yesterday, I was thinking too, people that have had trauma, we have no boundaries either. We have to learn how to set boundaries for ourselves because we tend to allow people to do things, and cross those boundaries.
Mm-hmm.
But at the end of the day, we teach people how
How
to
to
treat
treat
us.
us. Girl, you done took the words out of my mouth. You teach people how to treat you. I have a friend that come back and tell me that all the time. I remember you told me, girl, you teach people how to treat you. And that is so true.
And if we tend to keep these relationships because we're afraid of losing people, and that's all. This is mental. This is all comes with this mental wellness, so we tend to put up with things that we shouldn't put up with for the sake of losing people, but in the meantime you're losing yourself
You've lost yourself sometimes
and lost yourself.
and lost your mind almost.
So I mean, I think I would rather lose somebody else than to lose my mind,
Mm-hmm.
because I didn't been in that place, and I don't want to lose my mind because I'm trying to save somebody else,
Mm-hmm.
or I'm overcompensating because I feel like everybody deserves 15 chances. No.
Mm-hmm.
No.
Because when people show you who they are, you have to trust them, believe them.
Yes.
And so and the thing about too, writing things out,
Mm-hmm.
it gets it off of you, so then you're not carrying that heavy load.
Yes. Yes.
And you can't be fearful. See, I was fearful. I'm just trying to think about this. I was fearful of writing things down because I thought it would be found. I thought it would all be exposed before I was ready for that to happen, because you feel like there's going to be some major consequences to you opening up your mouth and saying what happened to you.
Mm-hmm.
And like that filing cabinet, sometimes you push it in there and you forget some of it until
Mm-hmm.
it falls open.
Yep.
And it's like it's happening all over again. And the ignorance that you were talking about earlier when it came to mental health, I heard people around me, well, if that really happened, what took them so long to say something? Like
Yeah.
you were saying, people expression and how they
Yeah.
respond to stuff, it makes you
Yeah.
shut down even more. I
Mm-hmm.
remember being in my office and I could hear the people just out there saying it, and I had to just close my door and say, God, it just, when is it going to happen? When am I
Mm-hmm.
going to be able to stand in my truth? Because I don't want that. But sometimes, most of the time, you're going to get that unwanted behavior
Mm-hmm.
and
Mm-hmm.
unwanted responses. But you got
Mm-hmm.
to stand in the truth,
Gotta
no matter
stand in your
who
truth.
turns their back on you, no matter who says you're lying, whatever it, when
Mm-hmm.
it is your time to
That's
tell
right.
your truth,
That's
you
right.
tell it
That's right. That's
without
right.
fear.
Yes. Yes. Because I mean, as a kid, just as a child going through those things, molestation or rape, you if it's somebody that's older than you or a father, somebody that you trust, right? In your mind as a child, you think this is okay. You don't know any better, so you're afraid to tell someone, because of course they're going to think you're lying, because who would think a father would touch it, or a mother would touch their child, you know? So you choose not to say anything because you're scared of what's going to happen to the other person.
Mm-hmm.
And some people go to the grave with it. So just imagine having that with them their entire life.
Some people go to the grave with it. I've had grown women tell me that their parents passed away not
Yeah.
knowing what
Well,
the
imagine
uncle
carrying that
did,
burden.
what the grandfather did, what the auntie did. They let their parents expire without sharing that information just because of the fear of what would happen.
And it's also the sake of protecting.
And also, yes, protecting.
Mhm.
And then you don't even know how they're going to respond too.
Right. Right.
Because I've heard a lot of stories, but this one, I don't know why this one kind of sticks in my head sometimes. But the lady had told me that she told her mama, she said she built up enough nerve because her sister's like, you have to tell mama. So she built up enough nerve to tell her mother, and her mother said, don't you dare repeat that. That would kill your aunt. And there it went, just like that.
Yeah. It makes you wonder what state of mind that other person's in,
Mm-hmm.
because one of my kids would have come and told me something, being the given the fact that it happened to me. I don't know how I would have handled it. You know what I mean?
Mm-hmm.
And being in the medical profession, I see and hear all kind of things.
Mm-hmm.
All kind of things. And my heart goes out, and it for myself, it took me, I was 19 years old before and it was what made me be able to talk about it, and I still really didn't talk about it freely until I got older.
Mm-hmm.
And I had patients that I had to relate to,
Mm-hmm.
was a trauma that I experienced with, you know, a boyfriend, you know, and that's how I was able to come out. And it was just almost like a mental break for me.
Mm-hmm.
So sometimes it could be just something that can happen, and it can just look like a switch of a light, and you can talk about it.
Mm-hmm.
You're ready to heal from it. But
Because you're
it's
tired of
good to talk about those things because people can understand how or why people behave the way they behave.
hearing. Mm-hmm.
Yeah.
Because I had to have a conversation with my children, and they're mature young men now, and so they were very forgiving toward me. I told them I was sorry for the way that I behaved and the way that I responded and the way that I showed up or didn't show up or whatever the case may be. And they don't even they don't even describe their life the way that I would describe it to somebody. We're much harder on ourselves than
Hmm.
the people around us, but they
Hmm.
extended grace, and I'm so thankful that they did,
Yeah.
because if you don't, you would be angry.
Yeah.
You get those feelings because it's like, I I turned into this person. I wasn't born this person. Like, I
That's
was
right.
born
That's right.
a child with a child mind, with innocence, and
Hmm.
stuff like that. And just
Hmm.
over time, I've said it on here, like, my first person to touch me inappropriately was a female,
Hmm.
which is the last person that a parent would think.
That's
Most of
right.
the time
Yeah.
you think that it's going to be the male,
That's
but
right. Yeah.
people are hurting, like
Yeah.
you said, and they hurt.
Yes. They don't know any other way.
And that's so hard for me to wrap my mind around, because it's like, well, how are you able not to go and abuse a child like that. Like my mind, I don't even think like that. Even though it happened to me
Yeah.
numerous times, my mind does not even think like that.
Mm-hmm. And a
So
lot of it is so many people are angry of what, the things that has happened to them. They have so much anger and bitterness in that somebody's going to pay for what happened to them. That's why it's so important to get help
that is so
so
sad.
that the cycle does not repeat itself. It's called generational curses.
I was just about to say, because you hurt so many people along the way
Mm-hmm.
just with your decision
Mm-hmm.
to do something like that. That
Mm-hmm.
person that you hurt,
Mm-hmm.
it just
Yeah.
changes. It
Yeah.
changes the direction of their life. And so, and then of their children's life, because now they're having to heal from, what I did to them,
Mm-hmm.
or how I behaved with them, or
Yeah.
my
Yeah.
little patience with them. And it
Right.
had nothing to do with them. I just hadn't dealt with my own stuff and
That's
trying to
right.
be responsible
Right.
for some other human beings. It wasn't working.
That's right.
Just was not working.
That's
But we
right.
made it through by the grace of God, and they're forgiven, very forgiving. And I've forgiven each and every person that I feel have offended me. And if they don't give me an opportunity to do the same, I just ask God to forgive me, because sometimes people just won't even talk to you. And
Yeah.
it's like, that's another thing I ain't got time for. I'm
Yeah.
just not that
Yes.
petty. I
Yeah.
guess, for lack of a better word, I'm just not that petty.
But if you're walking around in unforgiveness, it's worse on you than it is the person. So because you're
Yeah,
the one sitting there miserable.
because I'm gonna speak to you. I'm gonna speak, even though I
You
know
sitting there miserable, holding on to the
you
foolery.
you the one miserable, because I'm gonna speak and I'm gonna go on, and I'm not gonna lose no sleep. Let me tell you something, baby. I sleeps hard over here. Ask Maya. Ask Marie. Who else be trying to call me and wake me up? Ask Patrice. Girl, I be asleep. I ain't lost any sleep.
Oh
Somebody
God.
not talking to me, somebody not liking me, somebody being jealous of me, whatever your problem is with me, that is your business and not mine.
Yeah. 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 We can look, let me tell you, this mental thing is really, really serious.
It
It's
is
really
very.
serious. It's serious. And I believe that things have gotten worse since COVID. So
Oh wow.
we gotta get out here. Everybody has to get out here and advocate. And it's okay to not be okay as long as you get help.
As long
It's
as you.
okay. Yes,
So
definitely.
tell us about the journal, the book.
So
How were
this
you able
journal,
to create it, girl? What happened that made you want to create this journal?
this journal helped me when I was in a dark, dark, dark space. Just going through all the betrayal and all the stuff. I mean, we could talk for hours about these things, but God, I was laying in my bed, and that's when I took a leave of absence from work because I couldn't go anymore. I
Mhm.
was I was mentally broken, and I was crying out to God, asking Him why am I going through all of this stuff? I've been good to people. I've given, I've given, I've given. I'm drained. I've just tirelessly worked, to help everybody. And I don't deserve what I'm going through.
Mhm.
And so he said, why not? Jesus paid the price.
Can
So
I
I'm
get
still
another?
crying like, I don't want to do this no more. I hate healthcare and all this other stuff. And so God said, you blessed. And I said, you're right. He said, you was born royal. And so I said, yeah, I was. So I was born in February. Purple's my favorite color. So
Okay. My
so
sister's favorite color is purple too.
yes. So purple's it's royalty. And it speaks about royalty in the Bible, purple. And he said, you have everything you need. You were born Melissa. Melissa's your name. And Melissa means honeybee. And in the Bible, in the book of Exodus, the land was filled with milk and honey. That's overflow, right? And I was born in 1973. Seven was the year of completion.
Okay, girl,
And
come on
three,
now.
and three, the Holy Trinity, the Father, the Son, the Holy Spirit, right? And the guardian angel. So that's how I came up with Blessed Royal Honeybee 73. And the title Born to be Royal, Blessed to be Crowned. You know, all of us was born with a purpose, right? And a king and a queen, they walk around with a crown, right? They're royalty. And they're above all. And God gives us free will, right? And as we're going through all of these traumas and emotions and things that happen, it stops us from being crowned in our full potential and reaching our full potential in life, because we're looking at what others have and what this person did to us. So when I went through my journaling and, God reminded me, that you came out of all of these situations when you journaled and you referenced scripture. So it's time for you to take and help other people. And so I finished the book in less than a month, I think,
Mm-hmm.
because I was flowing, baby. He was giving me all kind of knowledge and wisdom. I
Okay.
was ready. I was ready for it. So it's a working journal, and it's for people who they feel like they can't even talk to anybody, that they can go in this book and they can work through the exercises. And each, there's sections that talks about anxiety and depression and grief and abuse and codependency and how to work through those things
And
in
mine
order
is
for
in
you
the
to be free.
mailbox. I hope mine is in the mailbox.
Yes, ma'am. Yes. Yes. And that's really, I mean, that it helped me to kind of, and I'm still on my healing journey,
Mm-hmm.
you know, um, but it helped me because 6 months ago, baby, I couldn't even see, we couldn't be talking right now, I'd be crying. Or I'd be in the bed, I couldn't get out the bed. So I've come a long way too. And it's just I'm one to I'm a resilient. I'm usually resilient. I take it all. Give it to me. I can handle it. You
Mm-hmm.
know.
Mm-hmm.
And I got to the point where I just couldn't handle it anymore.
Couldn't handle it
I
anymore.
couldn't. And I didn't want to pray anymore.
Oh
I
wow.
was done. But it gave me time to reconnect and to learn who I was, because I lost who I was in the midst of everything that I had been through, and just trying to help other people and putting other people before me. I lost who I was,
Mm-hmm.
you know. So it is important, to, like I said, self love and self care. you know, I choose me. You got to choose you. You got to choose you. Because what happened to you, it doesn't dictate who you are.
Yes.
Your mental health or your mental state does not dictate who you are.
Mm-hmm.
Because everybody was born with a purpose. It doesn't dictate who you are. And I have, like I said, I went back to school during the pandemic, seeing patient after patient after patient after patient, in because it was a calling that I had on my life, you
Mm-hmm.
know. And through it all, I've a lot of adversity, still going through adversity, lots of adversity. But I have to pick myself up every day, every day. But you got to want it. You got to want to be healed. You got to want to be delivered from it. Yep.
Now, I don't know if we talked earlier, but about you go into, I guess you started out as a nurse, going to
Yes.
Dillard University,
Yes.
and then you just continued to go to school. You loved it so
Mhm.
much.
Oh
You
yeah, I'm a career
were a
student.
student.
I'm a career student. Yeah, I started off at Dillard as a registered nurse, and then I went back and got my master's in nursing and business healthcare management.
Hmm.
Every time I had a degree, I had a baby, but I ain't having no more babies. I'm done with babies.
Oh, now you're getting puppies.
Yeah, I'm getting puppies and grandchildren. But so I went back and got my master's in business and healthcare management, and I said I'm done. I'm not doing any more schooling. I'm good. Well, went through a very bitter divorce, horrible divorce, and when I was went back to school and just couldn't finish it because divorce was horrible. And when I
Hmm.
met my current husband, he pushed me and he was like, "You gonna go back and finish what you started."
I
So I
love
went back
that.
and I went.
You're
So I
gonna
went back and I
start it.
him and my mother, because she's the same way. She pushes us. And went back and got my advanced practice nursing certificate and finished my doctorate degree in nursing. Um, I'm not going back to school. I'm done. I ain't doing it again. And then COVID hit.
At least you're going to school and not having the babies. You're going to school now without the
Then
babies.
COVID hit, and I went back and got the psychiatric certification. But I also have a certification or a diploma in substance abuse because I also do substance abuse. So I have a lot of different certifications in between that and some other different educations. So
How do you find the time to even, girl, we
it
all
was
got
it was
them
a
same.
coping mechanism for me.
Oh, yeah,
It
you
was
did.
really it was a coping. I was one of those people that I had to be doing something.
Hmm.
If I wasn't helping somebody or doing something, then it was like my life wasn't complete, you know. But eventually you get burned out.
Hmm.
You get burned out because I felt like I could save the world. I did. I still feel like I could save the world.
And look, and who's saving you?
Exactly. Exactly. While I'm drowning.
Uh-huh. But nobody knows that because you're so,
Yeah,
you mastered the coping
I
mechanism.
did. And I did a while back during COVID. I did this talk to some women in business. And one of my props was the woman smiling on one side and the woman crying on the other side.
Hmm.
And it was difficult for me to get through that speech because I was talking about women in depression.
Hmm.
And after I finished speaking to those women, I went back, I got in my bed and cried the entire time. Got back in the bed and was extremely depressed.
After you just finished
Just finished talking
encouraging.
about it. Yes.
Hmm.
Yes. So, like I said, depression, I could be smiling and screaming. That's just the way mental health is.
Hmm.
That's the way it is.
And you really be screaming from the inside, wanting
Mhm.
someone to recognize, but they can't see that.
Yeah. Yeah. But you got to be healed from it though. And it's
Mhm.
a part, like I said, it's part of the spiritual and healing journey. And and believe me, it's not easy. And especially when you're trying to do something positive, you're gonna be faced with a lot of obstacles. But you
Yeah.
just gotta keep pushing forward.
Hmm.
And iron sharpen iron. You got to be around people that's going to encourage you to keep picking it up and moving. And that's what and that's what I do a lot in my practice.
Hmm.
I do
Not
that.
butter knife sharpens butter knife. It don't work like
No.
that. You can't be with somebody dull
Nah.
and sharp on
Nah.
their edge.
Nah. And it really it makes me feel good when somebody can come back and say, if it wasn't for you, I would have jumped off the bridge, or if it wasn't for you, I don't know where I would be today. And it's not that I want praise for it, but I like to know that I was instrumental in making a difference in someone's life. That,
Yes.
if it wasn't for them, being led to me, they wouldn't be able to tell a story today.
Hmm.
You know?
I do. I do, because I've had the same thing happen to me, which is why I continue to show up, and I'll be trying to talk myself into being consistent. And it's not that I don't enjoy it, because I could be just as tired as I want to be. And it's like, I got a show. I'm like, oh, I got a show tonight. Like, this is something that I really do enjoy, because
Hmm.
I love informing people or educating
Empowerment.
people and
Yes.
empower. Exactly. And so it's like, when somebody comes back and they say, Miss Sunshine, you just don't even know how much you helped me. Like you said, it's not for you to get praise, but you need encouraging too, to say that what you've been doing, all of those early mornings, late nights,
Hmm.
long phone calls, whatever it
Hmm.
is helping
Yes.
somebody get through
Yes.
that day, because this is a journey. So
Yes.
it's one day at a
Yes.
time.
I like to say one moment at a time.
That's even better, because I could be happy this
That's
moment.
right.
And
That's
like you
right.
said, just gave a speech encouraging somebody else, and just go right
That's
on
right.
there and
Just
call
like I
it
said, I was out there encouraging people, went straight in the bed
straight to the bed.
and cried and cried and cried. So it's one moment. And like I said, it's a thin line between sanity and insanity.
It's definitely a thin line.
Thin line.
And that line sometimes get crossed over. You
Yes.
know?
But you
Yeah.
gotta have those tools though. You gotta have those them coping skills, and you gotta pour into yourself. And you have to affirm yourself. You have to affirm yourself.
Hmm.
We are our worst enemies. We are.
It's a shame that when you look in the mirror, you're looking at your biggest enemy.
Hmm.
You
Yeah.
think it's other people, but
Hmm.
it's you.
Yes.
And if you're going to say, I'm just trying to be better today than what I was yesterday, like if that's your competition, make it a healthy competition, not
Yes.
I'm beating myself up because
Yes.
you're so crazy. Oh, I can't believe you did that. That's so dumb. We have gotten so used to doing stuff like that. It's not uplifting to ourselves, you know? And so
Yes.
you say that to somebody else. And so if you
Hmm.
would, don't say it to self.
Are you looking for someone else to tell you?
Don't-
No.
Disappointed. You're gonna be disappointed if you sit
Exactly.
on somebody else
Exactly.
validate
Exactly.
you.
Yes. But you got to be healed from it, because it stems from somewhere.
Yeah,
It
yeah.
definitely, dysfunctional families, all of that. I talk about all that in the journal.
Well, I'm going to the mailbox and see if mine is there, because I'm ready to start getting it off of me onto the paper, off of me onto the paper, and I can't wait. I'm gonna have to
Yeah.
ask
And
you
if
and Ramona.
actually, God is kind of leading me to do this right now, on my heart. I'm gonna send you 20 journals, and if anybody wants to, or they can send email you or whatever, and just go ahead and donate those to whomever.
Because we have a meetup group. And so, like I was telling you, this is really how this got started. We would meet. So
Hmm.
we just started this back up, meeting once a month. And so by the time we meet, like if anybody wants the journal, maybe we can get them and talk about them, and go through
Hmm.
them and take that time as accountability to say, okay, this our girl time, this our journaling
Yes.
time. Bring your book, bring your pen.
Yeah.
Let's start to heal and do this journey together. So
Yes.
is truly a blessing. I was
Yes.
not even expecting that. And I'm sitting here still like, did she just say she's sending me?
Yes.
Let me tell you something. That's what I be praying for. Like, God, send some support for conversation with Celena, because the Lord know. Like you were
Yes.
saying, why me? I don't do that
Yes.
anymore. I don't say, God, why me? Because I've been this single parent for pretty much as long as I can remember. And God has seen us through every
Yes.
situation. So
Yeah.
we just
Yeah.
gonna praise our way right on through. And
Yes.
as soon as you start to wear thin and be like, I don't know, something like this comes and
Yes.
it may
You
seem
don't
small,
know where your blessings are gonna come from.
but it's huge for me.
Yes.
This is the beginning of people sending and blessing
Yes.
the
You're gonna
conversation.
get healed. You're gonna get healed. Your mental wellness you will have.
I received that.
You
Whew.
will. You will be made whole. And
Mm-hmm.
anybody else, any person that's on this live and you're struggling and you feel like you need someone to talk to, you need encouragement. Look, seek professional help, email me, whatever. Because we have a lot to do. We have a lot to do in the
Definitely.
mental health area. We
Mm-hmm.
really do.
Mm-hmm. Well, we are going to. I listen. I can't get in trouble, so I
I
have.
know. I don't want you to get in trouble. This was good.
This
And
was good.
that's why the devil tried to stop us.
Yes, yes. So we're gonna come back, and if you all have any questions or something like that, we'll be wrapping up. But I have to take this break, and then we'll be right back. Hang tight, my sunshine. Conversations with Celena. We'll be right back. Hey, sunshine. Y'all, let me tell y'all something. Woo, I'm still sitting over here just
Woo.
grinning from this blessing. But y'all
Yes.
be sure to send the graduates, because just like Dr. Watson just blessed me, it was on my heart to bless one of the graduates. And so it seems like the movement is not moving. And I want you all, even if they don't receive something, receiving the recognition and the acknowledgement that they went through and they
Yes.
successfully completed, whether it's kindergarten, junior high, high school, college, doctorate,
That's
whatever
it.
it is, because at all stages you need encouraging. So I'm not gonna say don't send the babies. Like that's where we need to start
That's
too.
it. It starts right there.
Start right there with the babies. So
Mhm.
please, if you are listening today or the replay, encourage a graduate to send their information, even if they're not comfortable in this setting, so where they come live, just like that video played, we'll have it up on the screen. I will read the bio that you send, the accomplishments, where they're going to school, whatever you include in it. I'm going to do my best to cover it all, put up the picture, and make sure that we just continue to celebrate the graduates in a different way. And so, with it being virtual, guess what that means? it's not just locally where I am. You could be in
Yes.
Texas, you could be in California, you could
Yes.
be in Tennessee, wherever you are, send it in on the email or the website, Celena1010, so that we can celebrate the graduate.
Yes.
So listen, you went and motivated those women. I need for you to motivate us now. I want you to motivate us, but you can't go to the bed and cry.
Oh no,
Yeah, yeah.
not
So
today.
not today, not today,
Not today.
not today, because we are encouraged, we are healed, we are whole.
Yes.
Mm-hmm.
Yes.
Yes, we are. So yeah, so motivate us tonight the way that you were motivating those other women to go forward in the full force in their purpose, whatever the God lay on your heart to say. But we're gonna close it on out because this was good to me.
Well, I tell you what, if I can do it, you can do it. God is no respecter of person. You know, everybody was created with a purpose in life, and it doesn't matter what it looks like. Just keep pushing forward, get tap into yourself and identify who you are in Christ, who you are in just in general, and just keep striving because God's no respect of person. What he does for one, he can do for all. And you all just be blessed and be crowned royal.
Be crowned. We coming up close for that. Say that one more time. We about to. Let me get this. Let me fix this. Woo! Say it one more time. I was in the back. I done come to the front. We both come front and center. Say it again, girls. Ooh, I play too much, don't I, girl?
Yes, Lord, but that's all right. I say, just look, kings and queens, it's
King,
time for you to be crowned royal. Okay.
hold up a minute.
Uh, that's what I'm talking about. Sunshine.
Baby.
Put your crown on.
And fix it, honey. Put it
Yes,
on and
ma'am.
fix it. Y'all go right on over there to my link. It's on Amazon and get your crown.
That's right. Put
Because
your
we fix
crown on.
journal. We gonna journal. Y'all go order your crown, honey.
That's
We're
right.
about to do this thing called life the
The
right
king crown, and this not just for women, it's for men too.
Yeah,
Men
right.
That's right. Men need to be healed. Let's
I
go.
didn't
Let's get
exclude
with it.
them, honey. Bring them in.
There's nothing wrong with a man crying. Cry.
Because actually I was trying to count up. I think this was the second year. I think maybe the second year that I was doing conversation with Celena. I think I had about 5 men. Once I started talking about my abuse, I was like, oh my God, like 5 men. And they're like, girl, I don't even know why I'm telling you this. And I didn't do nothing but smile because this is who I am now. This is my purpose. At the doctor's office, I don't even tell them I'm Celena anymore. I say, I'm Sunshine. And they just be like, I just love calling you Sunshine. That just makes me smile. Because anytime somebody says Sunshine, what are you going to do?
Yeah.
You're going to smile.
That's
And
right.
so it's like, I know that's my purpose now. Because I have men, I have women, I have young people that feel comfortable telling me because it's a safe space. Like I offer a safe
Yeah.
space for people to come and share and
Yeah.
talk.
Yeah.
And not just here. I have
It's
so many
relatable.
conversations. It's like I really am conversation with Celena
Yeah.
100% live and in person 24/7. Even when I'm asleep, I'm probably having a conversation with somebody, listening, talking, whatever, because that's who I have become. That's my journey. It may not be somebody else's. They may be looking at me talking about, why are you always on Facebook? This is what I'm supposed to be doing right now. Until my assignment
That's
changes,
right.
this is where I am.
That's right. And everybody has to learn how to meet themselves where they are and not trying to be above what they're not supposed to be.
Girl. and like yourself when you meet yourself.
Exactly.
When you meet yourself,
Because some of these assignments that y'all want ain't for y'all.
it's
You
not.
looking at what Mary and Sue got, but that ain't your assignment.
It's not. So when you meet yourself, greet yourself
Yeah.
and like yourself and love
Yeah.
yourself.
Yes.
Be good to yourself. Forgive yourself. We could keep going on and on what you need to do for self.
Yes.
And let me just look right here in the mirror.
That's right.
It's really a camera, but I'm looking right here in the camera.
That's right, baby.
Talking to me first.
You crowned, honey.
Girl,
You were born royal and blessed to be crowned.
blessed to be crowned. Girl, where my book at? Child, I'm so excited. You're going to have to come and join us when we first start with our
Yes, I
journal.
would
So you
love
can lead
to.
us.
Yes.
Yes, girl. We about to put it on. We about to have a whole
Yes.
virtual summit.
Yes. It's gonna be good. I have another lady came to me in the clinic and she said, I need 10 of those Crown Royal boxes you have. The Crown Royal box has the book here, and then it has a daily task journal with the blessed oil, and it has the crown, the pin with the crown on the top of it. So she's supposed to be doing a group 2.
Okay.
It's
Was
called
that
the Crown Royal box.
the Crown Royal box? And so I think that was on the video too.
Yeah, it was
The
on
video.
the website. Yeah.
Okay. All right. Well, y'all be sure to go to the website. Let me put it back up right quick before we close out. Is it going around the bottom of the screen?
Yes.
So that's the email address and that's the website. The phone number was going across the screen. It's 504-407-1635. And I'll put that right on back up there, 504-407-1635. And that is how you can reach Dr. Watson, our career student.
I told my daughter she's applying to med school. I said, well, maybe I'll just come to med school with you.
That
She
girl
said,
said,
Mama, please don't
don't.
embarrass me like that.
Girl, I could help you with your homework. I wish somebody would tell me they going back to school with me. We could do this together.
I told my husband, say, it's not happening. You're done.
I wouldn't mind going back to school. It's just the homework. I don't feel like being bothered with all of that. So hey, I'm gonna have to sit on over here and sit it out. I'm gonna have to sit this scanning out and let y'all do.
Oh no, I'm going back to school for something else. You better believe that.
Yes, indeed. Well, thank you all so very much for joining tonight. Mental health matters. Your mental health matters. And I'm so thankful for Dr. Melissa Watson for coming and sharing with us tonight tips and tricks that we can do, vitamins that we can take, getting the proper rest, writing for 5 or 10 minutes, releasing those things, exercise. Motion is lotion. You get to moving, like your body gonna operate better than if you're not moving. You're gonna be stiff. So get the moving. Cause remember, motion is lotion.
Yeah.
All right. Because it's good for your mental. Okay. Because we're here for the mental.
Yes. That's right.
And it all works together for your good.
Yes.
Yes and amen. Because this is connected to all the rest of it and it controls all the rest of it. So, we just love y'all so much. Thank y'all. Don't forget to send the graduates my way. In the meantime, KISS, keep it smiling, sunshine. Mwah.